Our team, welcome back to Plastic Surgery Untold, the greatest podcast in the world, as voted by us. Today we're talking a little bit about face and neck, the complicated marriage, if you will. We'll get into it in just a little bit. We got our special guest, the Cheek Chick, and so we'll get to her in just a moment. We got to save the best for last. But before we get too far, let's get caught up with our semi-celebrity cast that we found out about last week. What's been going on?
Oh man, been busy. Things are going well with the business. Things are moving forward. We actually just stumbled into a new dental practice up in Michigan. So,
oh wow,
this week is going to be all about going live up there with that. It's a pediatric dental office.
We have to change to worldwide anesthesia.
That we might, man. We're now in 3 states. So, or
like
we've been in
anesthesia.
What's his saying?
Right now,
Mr.
Worldwide.
Worldwide.
Right now, you're just the Frenchie of anesthesia.
That's exactly right. But yeah, excited about that. Really pumped to get that off the ground and going. So,
Tall Gamer, what's going on with you?
Oh,
okay, good story.
You're jealous. That's what
you got into a new house. What's going on here?
Yeah, so the new condo is coming along great. Still working on some little gotchas here and there, but trying to get it all figured out. Also got some things going on with South by Southwest that hopefully I will be able to announce here real soon. So
isn't that in like 11 months?
It is, but this is just my participation with South by. So
okay.
Just got to get some things out of the way, and should be some fun stuff coming.
Okay.
Very
cool.
Well,
congratulations on your secret moves here. So that'll be great. Austin's most beautiful man. What's going on with you?
A lot of the same old, just working and
Being
beautiful. Living the life of leisure.
Any second date updates with one Miss Anissa?
I'm still working on the first one.
Oh, so we can't get a second date update if there's no first date update. Boom, boom, boom. Okay, well, other than these lonely nights, what else has been going on?
I should ask you.
Just 2 dudes hanging out. Just 2 dudes.
No, I went to the Austin proper. We hung out.
Yeah, I mean, just 2 dudes watching the sunset.
Yeah.
It was sharing a little guacamole.
It was a moving moment.
That's so weird because my phone did not ring last night.
Wait, hold on. Wait a minute. I have my phone here, and I don't have an... Actually,
you did get an invite.
No.
Actually, Tall Gamer did get an invite.
No. Hold on. Wait, no.
Celebrity and the Cheek Chick were the only 2 that didn't get an invite.
Yeah, I didn't. My phone was blank too, Travis.
Listen, check this out. This was the invite. Hey, see if you can get in. It's already booked.
That's true. He's like, you got tickets for me? I was like, nah, man, I don't.
Terrible. That's cold. Cold-blooded, man.
Hey, I know that guy. I don't know him.
Oh, what? No, that dude? No, he's not with us. He's not with us.
I'm right here.
You mean you didn't give him Winston's ticket?
I did have a ticket saved for Winston, but I got a little nervous. He hasn't finished swimming lessons yet.
That's fair.
I'll tell you before we jump into this, Winston has not handled the heat well. Got him his granny got him a little stroller, so we were going downtown in the stroller because the cement gets a little hot for his paws. So
yeah.
he doesn't like that.
You pushed the dog
in the stroller. You want him to burn his paws, Donald?
No, you can put booties on him.
We're gonna have. Can PETA reach out to Tall Gamer? Instagram at Tall Gamer. Please feel free to slide into his DM, much as Gilbert did Anissa. So boom, boom, boom. Maybe the Cheek Chick can put a good word in for you, dude. Because
maybe
G Berto slid into her DM and she just ignored it. Not even a smiley face, not even the little emoji where you go like hands up, which
or the one with the closed eyes.
Like, where nobody really even knows.
I don't want to see it.
Yeah. I mean, because one of the vague emojis that nobody really knows what it means, so that way you don't like. I mean, it could have been funny if she'd give me a bunch of poo emojis.
It's part for the course, I would imagine.
Well, Sarah, talk to us a little bit. Maybe on the last episode, we talked about how celebrity got the name Celebrity Anesthesia. Maybe you can tell us how you got the name The Cheek Chick and what's going on in your life and practice. I feel like it's been, at least a year since you've been on the show. I appreciate you making time for us in your busy schedule. So thank you. We all thank you.
You're welcome. You're welcome. It's a Sunday. Those are my favorite days.
A little Sunday fun day, and you gave it up for us. Thank you.
Thank you.
She could still be drunk right now.
I may be heading out after this. The Cheek Chick. Lips were kind of my thing when I started with your practice, and now cheeks have become
the new lips.
The new lips. I mean, that lower facial augmentation. I think that's why we're here today. Just kind of trying to break the mold and not be so stuck on lips. So trying to give everybody a little bit of something.
Well, and I think this is, you already alluded to it a little bit, not to jump too far ahead, but I don't think people realize how much it all goes together and sort of there's different things, because a lot of times patients will come in with a very specific focus, but really to give them the look that they're trying to achieve, there's sometimes multiple steps that needs to go involved in that for the kind of whole transformation.
For sure, for sure. I think people come in requesting one thing, and a lot of times we convince them to try something else first. And majority of clients come back and are like, "Thank you for pushing me to do XYZ. I didn't realize."
I think a
There's
lot of that is
art
just
behind it, right?
yeah, it's just education, like
Yeah.
just explaining to them. Yes, I know that you want to come in because you feel like your nasolabial folds are deep, but look at where this is coming from.
Exactly.
And explaining to them that the reason they have deep nasolabial folds is because they've lost support in the cheeks. So
Hence the cheek check.
Yeah.
Thank you,
Well,
Dr. Franco.
No, and
Oh.
I mean, I feel like your practice has been so busy and exploded, and I think a lot of that has to do from kind of these transformation stuff in terms of like walking people through that. And I think when you see somebody who really specializes like you and Gilberto on some of these things, they're coming to someone that this is what they do day in, day out. And so, and it may not always be what they want to hear, but at least like you can guide them through and be like, hey, here's what I think you really need. I'm not saying you need to do it all right now, this second, but let's at least kind of make a roadmap to where we want to get to and decide how far along that road we want to go today.
Yeah, for sure. I love like 6-month plan, 1-year plan, all that good stuff.
And then we've been doing some fun stuff in the office, and maybe some stuff to talk about in the future. But been trying a few new products that we maybe bring into the office. Don't want to let Gilberto jump too much in here because I feel like he's already been playing with some of these new products. But maybe a talk for another day.
yeah, I'm excited.
Okay. Well, you're not excited. You're already doing it. So.
I'm excited to keep doing it.
Well, let's jump into this a little bit, if you guys don't mind. And Gilberto is probably going to take over a little bit for me here, as this is really his realm with Sarah and stuff. But we talk. A lot of people come in kind of wanting their lower face to be that little bit of a chiseled look, trying to make their neck look good. And we've talked about jawline in the past. We've talked about Kybella, but we thought this would be a great episode because you really, for most of us, you can't get a great neck or a great jawline without kind of addressing that whole area. And so maybe you guys can start a little bit about the non-surgical in terms of stuff like fillers, Kybella, those type of things. And then maybe at the end, we'll just touch a little bit on surgical, because if you got a neck that's just all the way down to your belly button, then at some point we got to address that surgically. And there's a few kind of mid-rim stuff, middle of the road stuff that's on the horizon that I think could be some good options for people again in that middle ground at some point.
Yeah, no, I think it's really important when, again, kind of getting back to what I was saying is
I can sit back and relax now.
is just is educating the patient, right? I mean, just talking to them, and they come in with their complaints and what they envision their treatment is going to look like. But I think it's our job to really talk to them and explain to them, look, yes, I see what you're talking about. I acknowledge that, but here's some other things that we need to consider. And with the area that we're talking about today, with like jawline and neck, I mean, there's a clear distinction between those two areas, and we want to try to like divide them so that they can give us the best aesthetic outcome, right?
When either of you are evaluating, like, how do you go about, like, if I came in and said, hey, I don't like my neck or I don't like my chin, like, how do you start the evaluation, or where do you go to start that conversation? Because I can tell you what I don't like, but I don't almost know how to fix it other than what I've seen on Facebook, Instagram, which may or may not be true or good or reasonable.
I think for me, depending on age, if it's a 20 something and they just have a really recessed chin, of course, chin filler, fine. Or they just don't have a very defined clear-cut jawline, that's fine. But once we get into the 30, 40-year-olds, we have to start addressing, I think, the mid-face to kind of bring everything
Just for
up.
the rest of us in the room, that's not old, though.
No, I'm 35. It's not old, but I think we get to a certain point where they're concerned about the lower face, but really it starts above that a little bit. Don't you agree?
Yeah, I think a lot of it, like we talked about earlier, it's due to lack of support, and then loss of volume, and that lack of support really plays a huge role because everything just starts to fall. Gravity just starts to play its role on the face, and so you start to see these nasolabial folds form. You start to see those jowls form, and then it starts to get kind of tough to distinguish where the jawline ends and the neck begins.
Mm-hmm.
And I feel like that's what some of people's biggest complaints is. They just feel like there's kind of no stop and start to to where the jaw kind of runs into the neck. And it's funny because it's the same complaint we get for some of our butt stuff is that, on the backside, they just don't feel like their back, ever rolls into a butt. And you're almost doing the exact opposite on the top end in terms of that. But so where would you start? And I know it varies from person to person, but maybe I love what Sarah did here. Let's maybe talk about a 20-year-old who, maybe just needs some tweaking. How do you do a chin jaw stuff? Because we talked about jawline, but I don't think we talked that much about chin. And I've seen you do some really cool augments that. I've even seen you do some little toxin mix with the filler stuff. Can you catch us up on how you decide who needs that and what you do?
Yeah, so I think it's all about profile balancing.
Mm-hmm.
Look at it from two different ways. First, straight on. Do they have like that V shape? Are they really flat on the chin? Do they need to be rounded out? And then also from the side. So nose, lips, chin. How are they in symmetry with each other? And we can figure out where to add filler. Like you said, Botox to the chin is another great option. A lot of people don't realize how strong that muscle is and how much they hold it up. That sometimes a little bit of toxin will just let that relax. And sometimes that's all they need. Other people need a little bit more. What do you think,
Yeah.
Gilbert?
No, I agree. I think so. The mentalis muscle, the chin muscle we're talking about, as we age, it starts to cause the chin to turn up a little bit, and our nose kind of starts to turn down a little bit, and that's just like normal aging, and we all kind of get this like smaller lower third of the face, and so it's actually more youthful to kind of relax that muscle. It gives you a more youthful look because it elongates the chin essentially. And so doing some Botox in there not only, relaxes the chin for other purposes, but it also preserves that youthful look.
Yeah.
And this is something where I think you guys are good at talking to patients about it too. Whether there's someone that would need, chin jawline filler versus a chin implant. And it's the great thing about being in a practice where you can offer all of those, a chin implant. And then there's people who get referred to me for a chin implant and may actually need some more, jaw type surgery, orthognathic surgery stuff. And a little bit harder when you get older in life. But, the nice thing is you can address all those levels of stuff. Typically, once you get a little bit older, you tend to be more chin implant, filler stuff because it's just doing a little bit of tweaking. When you start messing with the bite, it becomes a much bigger endeavor a little bit.
Oh yeah.
You start biting off a lot to chew on.
Hey,
You're welcome.
yeah.
You're welcome. Yeah. Okay.
Making sure I'm awake.
Dad jokes 101.
Yeah.
How many is that for today?
It's actually the first
Too many.
one too many.
What are your favorite products if you're doing a chin augmentation?
Chin, I love Restylane Lift, and I love Juvederm Voluma. I think we may be bringing on another product possibly to help out with that as well. So we'll have 3 to choose from. A little bit different time of longevity. The support's relatively similar though. Everybody is a little bit different price point too. So
I think those are great because there's so many, and people always ask, what's the best product? And it's like that. There's a couple different options depending on like your skin, your budget, how long you want it to last. So a lot of different ways to play with that.
Yeah.
G?
I agree. I like Voluma in the chin. I think it's a really great product all around. I would go maybe more like with a Restylane Define in the chin over a Lift. I like that because it just moves with the chin a little bit better. But my personal favorite right now is RHA and particularly RHA 4 for the chin. I think that's a really good product. I think it just works really, really well with the tissue and moves with the tissue really nicely. And we started carrying this product in my practice about 2 or 3 months ago. It's been going gangbusters.
I think the kind of common factor there is you guys all picked a little bit thicker, stronger product, for the chin jawline stuff, and which is super cool in terms of getting a good spot there.
Yeah.
Well, what else should we do to address kind of this unsightly marriage, if you will?
well, Kybella.
Ooh,
Kybella's great. Just did it myself about a month ago. The swelling is real, but I think the result is great. People need about, what do you see, 2 to 6 treatments, depending on how much submental chin fat they have. But
Yeah.
it's a good route outside of liposuction to just come in the office and get rid of
Yeah.
that stubborn
So
fat.
what exactly does Kybella do?
So it actually goes in and dissolves the fat that they have underneath the chin. So a lot of clients will come in, have a little bit more fat to the area, and they're requesting jawline filler, say. Sometimes I think it's best to kind of push them to do Kybella first, get rid of a little bit of that excess fat, then come in and do the jawline. Otherwise, they've just got so much under there. It depends on how much product
Yeah.
they're willing to use for you to really get a good
Yeah.
result. Do you agree?
It essentially, just to answer your question, it kind of like melts the little fat pocket underneath the chin, which
So is it actually removing fat cells?
it's
or?
it's like breaking down the fat cells, and then your body kind of like flushes them out basically.
Mhm.
But it helps create a nice profile.
Yeah.
and that's what Sarah's alluding to with and then we can add jawline filler later on to kind of give it a more defined jawline.
So that would be for the hanging neck?
Nope,
No.
nope. Because as she said, it really addresses the fatty, the tissue, the excess adipose tissue in that area. Also, I don't want people to miss something that she mentioned very explicitly in terms of 2 to 6 treatments, because it's not like if it worked that easily, we would just tell everyone to jump in a bath of Kybella and then boom, come out, chiseled
go.
from nose to toes,
Yeah.
But the flip side of that is that you get a little bit of improvement, wait, and then can decide, hey, do I need a little bit more? The majority of people need multiple treatments, but where that endpoint is between you and the provider, because you can say, hey, this looks good, let's do this. Or where Gilberto and Sarah can be like, hey, I think the best bang for your bucks at this point is going to be doing some jawline. We've got you pretty good. I don't want to do any more and have you have loose skin.
Yeah.
Okay.
And I think that's what's important is determining who's the best patient for this, because some patients do, genuinely have some fat pocket there, like a little fat pad, and some just have loose skin, and you have to determine what's the patient like. Do they have more loose skin? Do they have more fat? Some have a combination, and it may be a combination of maybe not only Kybella, but maybe doing some like J plasma stuff to tighten up the skin. There's a lot of different ways to approach it, but ultimately it's in the eyes of the provider, and making sure you go to an expert who knows what they're doing when they evaluate you.
For sure.
Someone that's lost a lot of weight, just right off the bat is kind of a red flag that you may not be a great Kybella patient if you've lost 100 pounds. The older you get, the more kind of, really got to evaluate. Again, there's some people, 40 going on 60. There's some 60-year-olds going on 40. And so it's a general like, hey, warning, but it's not there's not like an absolute contraindication to that. How do you two, because this is always kind of a question patients have. And even in my mind, it's always a little bit of a struggle is, where do you start though? Do you start with like the chin jawline filler? Do you do the Kybella first? I typically don't like to do them both at the same time, but I don't know what the two of you do.
I I talk to them and I ask them like, what's most important to you? This is the plan that I have. Like, what fits in your budget? Let's get together a plan. And I kind of let them kind of guide the conversation a little bit. I'll give them my input, but I think that ultimately, if you want to make sure that you get the best end result, you want to make sure the patient feels like they're being heard.
Absolutely. Yeah, I agree with that for sure. And like I said, I think a lot of people come in for jawline filler, but you can kind of persuade them a little bit just for their best aesthetic out and the end of the game for what they need to do. And they're usually really willing once you sit down and break it down to them,
Mhm.
kind of what's going to give them the best thing.
Yeah.
But do the two of you ever or typically do them at the same time, or usually
No,
not?
No.
I typically don't.
I think with the Kybella, it's a commitment too, because it's 4 to 6 weeks until they finally see the full results off of one treatment. So then they have to come back if it's 2, 3, 4. This could take months to essentially get rid of that submental fat. That's what's great about having you in the office, though. Like if they're more of a lipo J plasma patient, you can bring Dr. Franco in and say, "Hey, I think your money's better spent just going ahead and going to surgery." And
And for anyone who listened to episode 17 about Kybella, can you guys, you had that, so not to spill all your beauty secrets here, because you look lovely. Anyone who wants to check it out, we're on YouTube. You can see the lovely cheek chick, in the flesh here, looking absolutely stunning today. But we had one Fernando on here, and he was describing his Kybella appearance. And if Travis, remind me, what do you say to patients? A 1 is like what, and a 10 is like what?
Yeah, a 1 is hanging out on your couch, no issues, and a 10 is either being burned alive or actively being mauled by a bear.
And he said and he said like 15, so he was being
he
burned
was-
alive while being mauled by a
and getting
bear.
mauled by a bear.
While
For-
being attacked
Okay.
by killer bees.
Yeah,
okay.
for Kybella.
Yeah.
And because because
Fernando.
because
All right,
pain
Fernando, I'm gonna
because
have to
pain
wait
is
to
so
see him on Monday.
subjective, and I really do try to give my patients the benefit of the doubt. I didn't know how to feel about that.
So I will tell you, I spent 12 years in the ER, and we also say a 0 is obviously no pain. 10 is like having your leg chopped off with a saw. I would
fair.
definitely not say it's comparable to the saw to the leg.
Okay.
So you weren't mauled by a bear and set on fire at the same time.
No,
so
no, no,
not,
no, no.
So not a 15 for our listeners.
For Fernando, I would honestly give it, I'd say we will numb you topically. We'll do the injection maybe 20, 30 seconds after the product goes in. You notice a little bit of burning. I'd give it a 4 at the
Okay.
most.
Okay.
And it's pretty quick. Like I've seen both of you guys do this procedure on patients, and once you get going, like it's the marking, it's coming up. The game plan is the hardest part, and then letting them know. But once you get started, it doesn't take you guys very long to do the Kybella injections.
It's a fast treatment.
10 minutes or so.
So it's not like a 45-minute treatment there.
Of
Where,
agonizing temperature,
Oh man,
I just wanted to get that out there. Thank you, celebrity, for setting the pain scale.
Thank you for just making sure that we all knew what was really happening. Because after Fernando told us his experience, I was like, I would never. Touch that stuff.
We
That's
went about
terrible.
6 weeks before doing another Kybella treatment. Thanks to thank you,
Things dried
thank
up
you,
at the
Fernando,
office a little
for
bit.
doing that there.
Your local Kybella rep calling, what is going on? Y'all are not doing any Kybella.
I've got
Fernando-
people asking about being mauled by a bear and set on fire. I wasn't sure what they were talking about.
I'm pretty sure Fernando's still in pain.
Oh, yeah.
He probably is. Yeah. No, I would rate it a 4, and honestly, it was sore. I'd say a 1 for the last couple weeks. Now I feel just nothing.
But people do need to plan a day or two after the treatment where obviously you can function. You did normal day stuff, but maybe not the day before a photo shoot, wedding, big family event.
I'd give it a good 2 weeks, if not a month before. My swelling was real until about a week ago.
There's a lot of swelling.
A lot. The first couple of days, it just turns into really like a gel almost, and it's hanging. So it's a lot bigger than when you first come in, but the end result, I think, is great.
It's a weird sensation. It feels like your chin is full of water and you're just like swishing it around.
Yeah, there's some numbness there, a little bit of discomfort, kind of like a soft bruise, but nothing terrible. I did bruise a little bit. Arnica's great for that ahead of your treatment if you want to take the tablets or get the cream.
And then you guys both alluded to the loose skin, and this is where, deciding, is it a little bit of loose skin that we can do Renuvion J Plasma skin tightening, maybe an Ulthera. There's a few other type of skin tightening devices out there that help with a little bit. And then obviously there's I think for another episode, there's some new treatments out there, Elevate and some of these things that have been hitting the market and now having a little bit of success. So maybe we'll have some episodes on those in the near future. And then the ultimate, type treatment, which is getting us to neck lift, facelift, those type of surgeries. And so I think being able to be evaluated, because you also don't want to spend $3,000-$4,000 on Kybella, and it's really a skin issue type thing. And this is where, again, when they can kind of treat everything, they can help guide you. And I know Gberto's practice doesn't offer neck lifts, but their practice is really good about being like, hey, I can do that, but it's not going to get you where you want to be. It's not addressing your real problem.
Right.
Yeah,
Mhm.
yeah. I love that about our practice. I think we're super honest and we're happy to push people on to the next best provider if it's not something we can do.
Speaking of, for new listeners, where is your practice?
So we are on the corner of Burnett and Breaker, right across from the new soccer stadium. You should be able to see our sign very shortly on top of the building,
Mhm.
lit up, hopefully overpowering them at some point.
Yeah.
Nice.
That's the goal.
You're at the same practice as Johnny. I'm just trying to
Correct. Oh,
make,
correct,
make
correct.
it make it
With
plain
Dr.
for the new
Franco.
listeners.
Yes.
And you can follow her on the Austin Plastic Surgeon Med Spa. So at Austin Plastic Surgeon Med Spa, and she shows a ton of before and after pictures, walks through a lot of these. And actually, since we've been in our new office, we've started incorporating many more lunch and learn. So you can slide into her DM. She promises not to ignore you the way Anissa did Gberto. But if you have specific questions, stuff you'd like for us to talk about, please hit us up. Let us know. You can actually message us on any of our accounts at Sarah Mac or what's your other?
Mac_SA is my.
I was pretty close.
He was pretty.
I thought it was good.
Not at
Sarah
all.
Mac_SA, Austin Plastic Surgeon Med Spa. All of the above.
But definitely, if there's topics you want us to hit up, because we've loved these lunch and learns. I think they've really helped underscore. Most of these are spurred by questions that we get asked by all of you listening, and so we want to address the stuff that's important to you all.
Totally agree.
Go ahead, celebrity.
Yeah, no, I mean, that was kind of what we did with the anesthesia thing too. If you guys didn't check it out, a week or two ago, we did an anesthesia podcast, but then we also did some Instagram stuff too, where we answered anesthesia questions. But I wanted to say that I've seen Sarah's work firsthand. My wife, at Your Trendy Therapist, has visited.
Ooh, I didn't think you were going to get in today.
Oh,
I
yo,
got it in
gotta
there.
get it in there.
you know I'm going to get it in.
There you go.
But she has been to both Dr. Franco and Sarah for some injectables with Botox and I guess not filler, Dysport. And you do a fantastic job. So does Dr. Franco.
We won't put
I
you on the
learned-
spot to
I
ask you
learned
who her
from the
favorite.
best.
is.
I will not say who won, but It was very close. It was very
Can we put Sarah, the cheek chick, on the spot here, because I know that your wife is coming in sometime soon.
She is.
But Celebrity wants to get his first toxin treatment.
Hey,
I do.
Instead, maybe
I
they
do.
could do a celebrity couple
Let's do it.
treatment. So can we get a yes to this,
Absolutely, I'm
or
here
a strong
for it.
strong
Let's do
maybe?
it.
Can we
Yes.
get a strong maybe?
I'll take a strong maybe.
Yeah.
You're saying there's a chance.
Yeah.
Okay.
Yeah,
I have
I-
to get you summer ready glowing.
All right, so
that's
we
right.
got it on
I'm looking
record.
like
You're out in the sun running around with your shirt off all the time. We need that skin to be radiant.
She is not Botoxing your chest though. We gotta
I was about
draw
to
the
say,
line
is
somewhere.
that a different treatment?
Can I do Sculptra in my pecs? Can we start a new trend? Can we start a new trend?
I don't know if I'm the
Sculptra?
guy. I don't know if I'm the guy
Can we
for that.
Oh,
Sculptra?
you're the guy. You're the guy.
What about doing a little sculpture on his biceps? Can we do that? Give you.
What are you trying to
Well, I
say?
just,
man?
you
I'm,
know,
I'm,
didn't-
I'm
didn't-
up like
wasn't
5
it,
pounds
wasn't
right
your
now.
trendy therapist the one who said that your arms were getting a little smaller?
They were, and
You're welcome.
they-
That's episode 22. If anyone wants
yeah.
to
If anybody
refer
wants to go back to that, that was the episode of Small Arms, and it's been almost.
COVID prevented you from getting a gym, but you now have a gym. You're welcome.
I do now have a gym. I think we've almost remedied the whole situation, but yes, maybe sculpture in the arms.
So there's 3 or 4 episodes to come. We'll have to talk about this, but we got it on record now. The Cheek Chick has said that she'll do celebrity couple together. So
Relax this face.
I know you're a busy man, but maybe in the next couple of weeks we'll
Yeah,
get
we'll
something
make something
scheduled. Maybe make some clips that we'll share on the podcast.
Love it.
Okay.
Do it.
All right.
Here for
I'm
it.
excited.
We-
Now that celebrity's beautified, can we keep talking about the face?
Yes. So,
Enough about me. You guys can finish. Go ahead.
speaking of neurotoxins, masseter
Ooh, that's a good one.
for
That's
lower
a good
facial
nugget.
augmentation.
That's a good nugget. What do
You're nice and chiseled. I don't think that you'll need that, but others do. Gilbert, what do you think about that?
No, I like it. I think it does a really good job. I treat a lot of masseters in my practice.
I feel like that's a great hidden nugget that people forget about a lot.
Mhm.
Can you guys maybe explain what this does? Because I feel like a lot of people listening don't even know this is a thing.
Yeah. You want to go?
You brought it up. Take it away.
I'll take it away. All right. So we can actually inject the masseter. So when you're chewing and everything, a lot of people grind their teeth at night. They have TMJ. They come in complaining of pain when they wake up in the morning. So it can be aesthetic, or it can also just be comfort treatment, one or the other. And it actually works by just slimming that muscle down and gives that really nice V shape to the face. Takes a while though. Isn't like a 2-week thing. We got to let that muscle shrink, but then we can come in behind that, add jawline filler, contour the back of that jaw really nice.
It's like celebrities' arms. They didn't shrink and grow overnight. You know, it took a few months of COVID for them to shrink down, but they're slowly working themselves back
I
up.
think it's a great treatment, and you can tailor it. Wait a couple months, come back in. We can treat you again. And what do you think?
Yeah.
I also think that people get a little bit more time out of it than like if you're treating your 11s, because to the point that you're letting that muscle shrink, it doesn't pop right back up. Has that been your guys' experience a little bit?
Maybe a little bit longer than the traditional like forehead and brow treatment. I think I usually have my patients check back in about 4 or 6 months after we
Yeah.
treat.
For sure.
I would say 6 months. We've seen people, and I think some of it too, maybe don't notice it quite as much. This is front and center, so it's the 11s you see right away.
Mhm.
And how do you guys go about evaluating whether that's going to really be helpful for them or not?
I think sometimes it's just visible. Like you can actually see the muscle just kind of like bulge out.
Yeah, we'll have you bite down, see how strong it is, kind of let them sit relax, see if it's actually really prominent relax. That's
Mhm.
the ideal candidate, is to just get that to shrink down.
Yeah.
nice and soft.
And some of us, because I grind my teeth a ton, so I feel it. Thanks, guys. Neither of you have ever offered to Botox my masseters, so I'll just stay. I'll just stay with my round face. Don't you guys worry. That's cool.
Let me give it a shot.
Here I could look 10 pounds lighter, and the cheek chick is holding out on me. Thank you, Sarah.
Got you next.
She works with you. She
I-
sees
I
you on
know,
a daily
she-
basis.
I know. She just doesn't want me to be pretty.
She
Thank
can
you.
stab you in the hall.
No,
Yeah.
I know.
And you guys only see each other on the weekends when you don't invite me to the pool.
The sun. It was a sunset.
Yeah.
thing,
Oh,
so
the
The sun was in
going-
my eyes.
Got
Like
it.
I couldn't see
You
very
can see
well.
the phone to text me to let me know where.
Texted us.
Yeah.
I'm just trying to look like Winston, you know. Thank you guys for making me look like Winston.
Dogs and owners resemble each other.
We-
Dang.
I'm gonna put some skinny jeans on, and Winston and I will look like little Twinkies,
There you
tiny
go.
little legs, big old trunk. You know, there's an event coming up this week, and so I'm trying to order him a little suit so that I can put him in a little suit, and then put on my sports coat, and we walk in together. Just
On,
you know,
on that event, did you invite Celebrity or I?
no,
Okay.
you want me to put you in a little suit too?
First off, I could rock that little suit. And number two, I just wanted an invite. That's it.
What about because I don't want you guys to have all the fun, but it's a procedure that really I feel like over the last couple of years we've done so many more of buccal fat removal. I feel like that's one, again, it's sort of like masseter in that it's more of a subtle difference. Not everybody's a candidate, but I do think it makes, in the right patient, makes a nice difference of just slimming the face just a little bit.
Yeah. Yeah.
Before we
I'm sorry, go ahead.
Yeah, before we get to the surgery stuff, though, I did want to like hear you guys touch on like J plasma and the energy devices as they are sometimes referred to.
Yeah.
So for those that aren't necessarily a good Kybella candidate, what's your evaluation there?
Yeah, I think it just really, really depends on the level of skin laxity. And so I would say, other than our 20-year-olds that a lot of times are doing a BBL or something, we're already doing lipo and we'll lipo the neck. Those people tend to do really well. Our patients are, again, a little older. And I've talked about this with arms, inner thighs type stuff. I will push them to do some type of skin tightening device. I think right now the Renuvion J Plasma and the Body Tight are probably the two best devices on the market that can be incorporated with surgery right now. And it just helps tighten that skin a little bit. Again, I tell everybody these devices are not a replacement for a neck lift, for a tummy tuck, for an arm lift. If those are going to make you 80% tighter, these make you about 20% tighter. But again, it's, the spectrum, right? Kybella is these tiny little injections. You're never going to see the incision spots you can do in the office. Neck lipo, J Plasma, Renuvion of the neck. You basically a tiny little incision at the base of the ear, do it all through there. If that's all you're doing, you could really do it on a Wednesday and be back to work on Monday, other than the bruising. Just depends on how you feel about bruising and those type of things. And then the bigger spectrum is neck lift, where you're actually taking out a significant amount of skin. Sometimes when people confuse this to fullness too, and this again where a good provider comes in, older patients, sometimes that platysma, the muscle, let's talk about that in a second. Platysma starts to fall a little bit too. And if people don't really know that, that's the muscle that goes underneath our neck when we tighten, that can make the lines come across. But also over time, just like anything else, that muscle, even though it's a band that comes all the way from the bottom, can fall too. And so sometimes it's not fat. That muscle is actually relaxed a little bit too, just like it can on the belly. And that gives us a rounder, fuller neck. And when we do a neck lift, we can actually tighten those muscles. Which is super cool.
No, I was going to say it's similar. I kind of think about it like a chin strap in football.
Oh, yeah.
Like over the years, like if that's a leather chin strap or something that's not, plastic, that'll start to elongate or sag during that time. And then, during a neck lift, you're actually doing a muscle plication, putting that together.
I feel like that brings us back to your all-state cornerback, because you were actually a high school cornerback. Is that not true?
I was.
You were?
I don't know if I was all
state. He said he loved his man-to-man defense. He was just like fly on something.
I would watch that man score touchdowns. Why is that man 20 yards behind me? Yeah.
But let's keep talking about platysma. So we worked it down. That's a really good one.
What can you do from a non-surgical? Because I only get to see that muscle repaired during surgery or when we're doing a neck lift. What are your options if we don't go to the OR?
Interesting, you should ask.
Oh, it's almost like we planned this.
So like Johnny was saying, the platysma is this like sheet muscle that comes all the way across the jawline and then down into the neck, and that's what gives us these like long bands in the neck. There's actually a toxin treatment that can be done. It's been called the Nefertiti Lift, named after the Egyptian queen, because she had such a long, lean neck. And so basically, strategically placing Botox along the jawline and then down those platysmal bands can relax those muscles, because the platysma muscle, like John was saying, it pulls the muscle like together down, and so it pulls the face down. When you relax that muscle, it kind of creates that lift.
Will that decrease the lines in your neck?
It does, yeah. It won't make them disappear.
Sure,
It won't make them disappear entirely, but
and is that with is that dilute Botox, or are you just using full strength?
Full strength, but again, strategically placed and preferably done by someone who knows what they're doing, someone who's experienced, because there are some small risks that can come from a treatment like that.
You got to stay superficial.
Yeah.
This is one we can't be messing around. You got to stay superficial in the right place. It's super, super, super safe. But can't be cowboy about it. The platysma bands I love, because I think they're, especially someone who knows they need a neck lift, or in the person who just has 2 or 3 very discrete bands, the rest of their neck looks really good.
Yeah.
I think is an ideal
Yeah.
candidate for this, and they can look good. I've done this treatment. I didn't know the fancy name that the G Birds has just dropped on us. A little hidden nugget behind the Bovie early. He texted me about that treatment, and I told him I didn't know what he was talking about, but now I do. Thank you.
I'm dropping little knowledge bombs on you.
Boom, boom,
right.
boom.
For those that are interested, how often do you feel like you treat those clients?
I don't get them too often,
Uh-huh.
but it's once every
Still get the
yeah.
longevity, say like every 6
Oh yeah,
months
you
as
get
far as
you get
visits?
good longevity
Yeah.
because again, those muscles, they're not muscles that you're using like routinely,
Right.
and so you get more longevity out of it. Yeah.
I love that, you can do some of these little tweaks, and some of these, it's funny because patients will come in and sometimes don't even notice. And I think one of the cool things that I know the three of us do is when somebody comes in, we'll be asking them questions, but a lot of times it's just giving them a chance to talk and for us to kind of evaluate their face. So if you're ever talking and it kind of looks like we're focused elsewhere, we're actually focused on you, because when people talk and move, there's also some fancy Botox stuff you can do around the mouth, near the chin. We talked about the chin itself, but there's the DOA muscles and some of these that help kind of that contour too. And when you watch, you can watch the facial movements, whether it's the masseter, whether it's the muscles around the mouth, whether it's these neck bands that occur in people's kind of everyday life once they get relaxed and can kind of turn into the regular routine.
Yeah.
Right.
See, I
Yeah.
just thought you were judging me, but now I know you're
Yeah,
sizing me
yeah,
up. That's
size
what
you
it
up a
is.
little bit.
All right, all right.
Yeah.
Because I think people forget about and sometimes there's some things that are just maybe 10 units, something really small that makes a big difference.
Big difference. Yeah. Like people have like the corners of the mouth that turn down. You hit those DAOs that Johnny was talking about. It'll relax them and then just get that smile back up to like a neutral position. And it changes the way you look for the better.
Now, DAOs or DOAs? You said DOA.
DOA, depressor orbicularis angularis.
That's what I thought it was.
It's
Boom, boom.
DAO.
DAO, depressor angularis orbicularis.
Depressor anguli.
Uh-oh.
Well,
Depressor.
it's orbis because it's mouth.
Yeah.
Okay.
Depressor anguli oris.
Boom. Thank you. This is why we have G. Berto, the greatest
Dang.
on earth. Thank you, G.
You're welcome.
Thank you, G.
You're welcome.
We also talked about corners of the mouth, and that's something we had talked about. We talked about touching up with a little bit of toxin. You can also do a little bit of filler stuff. You want to hit that up? We're running a little short on time, but we got a few more nuggets we can drop with people.
Yeah, I think the corners of the mouth to just come in and kind of thread some filler to get that upward turn of the smile. I think gummy smile toxin is really
Ooh.
good too. To come on the outside corners of that nose there, just to get that top lip to just relax a little. I think that's another good thing for lower facial augmentation.
I think the kind of cool thing is, the jawline, which we've talked about, the Kybella, which, is not like being mauled by a bear on fire, is stuff that we talk about all the time. But there's so many little stuff on this lower third that can make a big, big, big difference for people.
Yeah.
And this is where I think somebody like you guys can really help and make some little tweaks. What other kind of nuggets would you like to cue people in when they're looking at kind of the lower third of their face?
I would say don't just envision yourself like head on, just because that's how you see yourself, but look at yourself from different angles too.
Absolutely.
And I think you talked about that at the very beginning of the show in terms of balancing that whole face and looking at everything.
Yeah. I think consults are key, just coming in and really assessing what it is that's bothering them and then telling them the most appropriate way to treat it. And I think people end up loving the results.
Yeah.
What about Eve? Because some of the stuff you guys have talked about is time to get those results. Let's say you're getting ready for a wedding or some big event. I mean, what do you think is realistic in terms of timing for people to come in for this? Because I think, unfortunately, I feel like we get people who come in. I had this very recently where somebody had a wedding they were trying to be ready for in less than a week. And it's just like,
If it's a wedding or something, I like at least a month, because then if something's a little off after the 2 weeks when the filler settles, we can come back in and tweak it. I wouldn't wait till that last week to 2 weeks. You're gonna end up with bruising.
And then when somebody says, "Oh, well, you never give me a bruise," I was like,
Always.
I like, you've just sabotaged us. You have sabotaged us.
It's like talking to a pitcher in the middle of a no-hitter.
I know.
Yeah.
I know. Hey, dude, nobody's got a hit. It's the bottom of the ninth. This is so cool.
It's last out.
Thanks.
You just don't do it.
What about you? You think is a month about what you would tell? Obviously, the sooner the better. But
I think it just depends on what you're doing. Like if it's Botox, maybe a couple weeks. If it's Botox filler, like a month maybe before the big event.
Because the problem with Botox, Dysport, Xeomin, Jeuveau, any of these toxins out there is it doesn't happen instantly. So you need a little bit of time for it to kick in. And I don't know how you guys feel, but I feel like people look even better, 2 months down the road than they even do 2 weeks, because most of the time it's getting those muscles to stop making those little creases.
Yeah.
Absolutely.
Yeah. I stand by my comment. I think, anywhere between 2 weeks to a month before an event. If you have more time, sure, but no sooner than that, I don't think.
Agree. The other thing that last thing, just to get your guys' thoughts, and then we'll get to our behind the bovie. We'll see what Sarah has in store for us. But what about when I typically do stuff around the mouth, I tend to start very, 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 very light, because sometimes a little bit goes a long ways, but sometimes can also be, if you change somebody's smile, do some of those things, not everybody tolerates it well. How do you guys approach that? Because I think it does some phenomenal stuff, as you talked about, where a little bit of product can go a long ways. But how do you balance finding a perfect spot for them in terms of that?
I always start, especially if it's a toxin or filler naive patient who's never had anything done, I always start super conservative, and I tell them, look, you've never had this done before. You don't know how it's going to turn out. You don't know if you're going to like it or not. Let's start conservative. We can always do more if you feel like we didn't get you to the point where you want to be. But once it's in there, for the most part, it's very hard to get it out. Filler we can dissolve, sure, but like Botox, if I do too much Botox and you don't like the way it turns out,
you're stuck like that.
Yeah.
And fortunately, around the mouth, because we do such little, it's usually a weird sensation, which tends to get better after a couple weeks, but sometimes can.
And I think you just got to be careful too, because you obviously don't want the toxin to migrate into a muscle that you didn't intend to treat. We were talking about the DAOs earlier. There's another muscle right next to it called the depressor labii muscle that kind of pulls the muscle down. If you hit it, it's going to create an asymmetrical smile.
Sure.
And so you just got to be careful.
What, Sarah, any last take homes you want for our listeners to take home from this about when they're treating the lower third of the face? We talk about listening to their provider. Any other nuggets, thoughts you have for them?
I think before and after photos, I think coming and being willing to kind of come up with a plan. Sometimes all patients aren't just one office visit. It can be several treatments, and we're more than happy to work with you and make sure you're a client for a while.
What about wish pictures? Do you guys like wish pictures in terms of this? For surgery, we use them. How do you guys feel in terms of injectables? Do you guys like that when you're doing lips, jaw, cheeks? Is that helpful for you guys, or not really?
I think it helps me give me an idea of what they're trying to achieve. I can't say that too many of my patients come in with them. I'll ask them, do you have any? And oftentimes they don't, but they'll give me an idea of what they're looking for. So I think they're helpful, but I just don't get a lot of them.
I do. I feel like a lot of our clients come in. We get a little bit younger clientele. They come in with stuff that they've seen off Instagram or Real Self and different things. And I think it's really good to just be honest with them. Hey, this person probably had 6 syringes. We can get you there, but not today. But we can make it happen more than likely. Or lip shape.
Or we can't.
Or we can't. Or lip shape can be totally different. They could be looking for something that's just not within their aesthetic goals, and it's just not going to happen. But like you always tell people, big, full mean different things to everyone.
Yeah.
So I think kind of just focusing more on, okay, what do you like about this before photo? Is it the central pout? Is it different things? And we can kind of tailor their treatment to that, but maybe not get you to look exactly like the photo.
I think my patient clientele might be a little different. I have a varied mix of, older patients and younger patients. For like my older patients, I prefer they bring me a picture of them like from 10, 15 years ago.
That's a great idea. Yeah.
Because they want to kind of recapture that youthful look.
Absolutely.
And that's what my facelift patients typically do is bring in something like that. I think the pictures either way, whether it's something, that they want to get back to that they've had, whether it's something else, I can't stress enough what you're saying. Just all of us here, and even celebrity with, his anesthesia standpoint, we want patients to have a good experience. We want them to be super happy with what goes on, but it's hard if we don't even know what your goal is. And just in this day and age, I feel like stuff like natural, full, subtle, big mean a lot of things to a lot of people. I mean, I've had people say, oh, I want some big full breasts, and they bring in a picture, and I was like, oh, that's actually the before picture. So what they thought was big and full, I'm like, oh, that's not. I've had other people say, I want something super subtle. And they bring me a picture right off a porn site of these 800cc implants. And, and what they were talking about was subtle, natural, was the roundness and the way they've dropped, not the size. And I think some of these things are really hard when you're talking about people's facial features, body parts, and so forth. I think so. No, I love it because you guys have both mentioned it. Consultation time. We want to help them get to where they want to be. I mean, we have our personal, biases, but we'll help you get to where you want. We just need to know where that is.
Yeah. Do you guys ever have patients coming in and say, "Oh, I don't know, just whatever you think is best"?
For me, that's the hardest thing.
Yes. And that's when I'll get a little bit deeper in the consult and kind of just point out certain things and say, what is the biggest? I think you do that too. What's the biggest thing you want to address first?
Yeah.
Let's start there. That way we're pretty sure we're both going to be happy with the result and we can add to it.
Yeah.
Perfect. Well, let's do a little behind the bovie. Any little hidden nuggets the two of you would like to give us?
So just to kind of get back to like the toxin stuff, one thing that I don't know if a lot of people know this, we're treating muscle movement, right? But some muscles, depress the face and some elevate the face. And so that's one thing that I'm not sure a lot of people know, at least maybe not the general public. We know because, that's what we do. That's what we studied. But there's certain areas where you're injecting muscles to elevate certain aspects of facial expression, and you're also using it to depress certain areas. So I think that's kind of interesting.
Yeah, I second that. I agree with that. I've had a couple clients recently come in because just simply for the downward point of their nose, we'll just do a little bit of toxin right underneath and just lift that area up. They didn't even know it was a thing. So I think there's a lot of cool stuff like that.
That's some of the cool stuff and it's not very many units. And this is where if you're already doing, cheek filler or something else, and you just want to do a few little tweak stuff. So if there's something that bothers you, bring it up because sometimes the treatment is super easy. Sometimes it's not, but you guys will talk about that. So that's super cool. That's a good one. That's another good one we didn't touch about. So that was a really good one. Can we get a quote of the day?
Yeah.
Either of you? Yeah. Oh.
I'm gonna let you bird
A celebrity's taking this episode off.
I am, man. Yeah.
He hosted, the anesthesia one, previously.
I'm just over here doing curls in the corner.
He's still recovering a little bit, but take us home here. What's going on?
So this one is from Dale Carnegie, the writer. It says, "Success is getting what you want. Happiness is wanting what you get."
Ooh.
That.
That's a good one.
Yeah.
Like that.
That's a good one.
Yeah, I thought that was pretty cool.
You brought the thunder today.
Yeah,
you did a great job.
I feel like every time I wear the red blazer,
Power blazer, man.
It's like
Power blazer.
It's like
Maybe I need it. Maybe I need it for next
It's like your
episode.
Avenger suit. You've got the red and blue,
You come dressed for success, instead of like in scrubs.
You should have sent that. Cheek Chick, can you take a picture of G right now to send to Anissa? That way she can see
what the power blazer looks like.
Power blazer. Boom, boom, boom.
I got
it. Thank you. I'd like to thank the lovely and talented Miss Sarah Mack for sharing her knowledge with us today. Hopefully you'll come back. I feel like there's so many more topics. There's a few other cool things on the horizon. New toxin coming on, new product we're probably bringing on. So lots of stuff this fall that are going to be absolutely fabulous. So hopefully more to come. Don't forget, you can slide into her DMs, not for dates. Well, maybe for dates. I don't want to speak for her, but definitely for any informational stuff that you'd like from us. Send us. We're happy. We'd love to address your questions. Her and we say Sarah Square, sophisticated and sexy, tend to do their own lunch and learns without me now, but they'll cover a bunch of the med spa topics, which I think is great.
Yeah, looking forward to it. We're growing and growing.
So,
boom, boom, boom. Celebrity, anything?
I'm looking forward to me and Mary's
He's not
date
gonna let
with
us
y'all.
forget this,
I will not let y'all
Yeah,
forget.
no.
And we'll take some video and we can and I can give you guys at home my take on how bad it really hurts.
Yeah, hopefully this isn't a 50.
The Travis Osborne pain scale.
We should have Fernando come in and observe.
So one question I had was, is the bear on fire, or are you on fire getting mauled by the bear?
You're on fire getting mauled by.
I mean, I think when you're
The
a
bear might be on fire too.
Yeah, who knows?
Everything's on fire.
And that concludes our podcast.
We're done.
On that
We've
note,
gone off
we're
the
on
rails.
fire.
Santa's never coming back.
We appreciate all you guys listening. Download us Plastic Surgery Untold on iTunes, Spotify, iHeart, wherever you get your favorite podcasts. If you want to see us, we got the Austin's Most Gorgeous Man. We have the gorgeous and beautiful Sarah Mack. So definitely should check it out on YouTube as well. We'll see you guys. All right. Bye.
Appreciate
Later.
it. Bye, guys.